Good afternoon. Thank you for joining us, and thank you for your patience. Apologize to everyone that couldn't stay with us or won't be able to stay with us for the second half hour because of your schedule today, but we will, obviously, Rachel, make sure that we go into extra innings or tack on another half an hour as originally planned. I do realize that you could have probably ordered a pizza and had it delivered by now if you were waiting by your computer screen or by your television or however you're consuming your news. But again, we've got a lot of important information to share today, so thank you for your patience. There are no conspiracy theories here that should be going around. Rachel, I could literally feel people saying, "No, Governor, unmute your phone today," and it is unmuted. Technical difficulty. There was a lot of, got a little hot in the kitchen around here. Everything's calm now, but people were scurrying around making sure that technical connections were being made. So here we are. I did want to say before we go to Dr. Box and get some updates on our relevant health indicators that earlier today, myself, the Speaker, and the President Pro Tem, Speaker Houston, and Senator Rod Bray all put out statements concerning a 4 or 5 day lingering conversation about school funding and the amount of funding, albeit whether it would be 100% or 85% during these very uncertain times. Obviously, we all feel that the most ideal location for a student to learn is in the classroom. We're not in ideal times. And so when the issue was raised on what would the funding amount be, we got to work and started to look at all the different options that we would have to address this and quite honestly honor, speaking for just myself, the commitment for 100% for our schools. So the law as written actually contemplated, thankfully, that the SBOE, the State Board of Education, could convene and address and move the counting date, that ADM date, move it back for various reasons. And they mention extreme patterns of in-migration or illness or natural disasters. Obviously, this is an illness of epic proportions that we find ourselves in. And so we are recommending, all three of us are recommending that over the coming days, we want to make sure every T's crossed, every I's dotted, but that we ask the State Board of Education to move that date back, then thereby locking in that 100%, move that date back to December. That gets us into January, and we can have a full conversation about everything under the sun come January in the General Assembly, obviously back in the building, we hope, and so we can have this and other discussions. But that will hopefully bring about some ease and alleviate some of the concerns, some of that uncertainty about funding for our schools. They have done a yeoman's job, heroic work. I know it's been a Herculean task to manage this on a day in, day out basis, but as we say around here, school is back in session, and as we have talked to schools all across the state, there's a lot of excitement about not just reconnecting, but learning and seeing your friends and seeing your teachers, and we want to make sure that we as a state are doing everything that we can to alleviate those concerns where we can. So enough about what we can't and can do. Why don't you, Dr. Box, give us an update on our health indicators as you see them as of today.
Thanks, Governor. That's great news. Good afternoon, Hoosiers. Today we reported 671 additional cases of COVID-19 in the state of Indiana, which brings our total to 76,522, the total number of Hoosiers known to have COVID. We also saw 15 additional confirmed deaths. To date, 2,878 Hoosiers have died of COVID-19, and another 208 are believed to have died from this disease based on their clinical diagnosis. Our 7-day positivity rate has also increased to 7.7% as of August the 5th. On June 19th, our 7-day rate was 4.9%. On July 4th, it stood at 6.7%. Currently, more than 34% of ICU beds and nearly 82% of ventilators are still available. 13% of occupied ICU beds are housing patients who either have been diagnosed with COVID or have symptoms of COVID. Nearly 3% of ventilators are being used by someone who has COVID or is suspected of having COVID. We also have seen nearly 867,000 Hoosiers tested for COVID-19, up from more than 792,000 a week ago. In the month of July, our ISDH team alone tested 26,000 Hoosiers at roughly 3 dozen clinics. Our Optum sites tested nearly 79,000 people in July and have tested nearly 188,000 Hoosiers since May. Again, as a reminder, all Hoosiers can be tested for free at any Optum site or ISDH drive-through clinic. Our partners at Regan Streif had looked at over 74,906 cases to date. Of those, 22% visited the emergency department, which is consistent with what we reported last week. A total of 9,599 were hospitalized, which represents 13% of all positive cases. Of those who were hospitalized, 21% were admitted to the ICU, which is consistent with what we've been seeing. That represents 3% of all of our positive patients. 72% of hospitalized patients have been discharged. Of the remaining 28%, 10% are believed to be in the hospital, 18% are known to have died while hospitalized, and Regan Streif also estimates that 76% of patients have recovered. While these numbers are holding steady, I do have concerns. While we've been able to maintain stable ICU and ventilator capacity, our hospitalization numbers continue to trend up. We've gone from a low of 595 Hoosiers being hospitalized for COVID on June 26th to 964 as of August the 10th. That's one of the highest numbers that we've seen since the end of May. And while our number of patients admitted each day has dropped, our positivity rate has continued to climb. These steps we take in the coming days and weeks are going to be critical to reversing these trends, especially as we get close to our Labor Day weekend. We have seen all of these metrics increase significantly a couple of weeks after July 4th, when many people gathered and didn't practice social distancing. We have been able to link many of these cases to holiday gatherings, graduation parties, and weddings. My fear is that we will see another spike after Labor Day if people continue to ignore our guidance. If we want to get all of our kids back in the classroom and reopen all of our businesses with workers in the office, we cannot behave as if things are normal. I hear every day from people who are angry that their children are back in school, and some are angry because their children have to learn remotely. I hear from teachers who are afraid of being in the classroom because they have health concerns. And I hear from people who are being assigned to new employee trainings in small conference rooms where no one is wearing a mask, and they're wondering if they're going to get sick or have to quarantine before they ever get their first paycheck. This is our story right now. And if we want to change the narrative, we all have to do our part. So please keep wearing your mask. Stay home if you're sick. Don't send your children to school if they have any symptoms or are waiting for test results. And please, if you get a call or a text from a contact tracer regarding yourself or your child, answer the call. Tell them if you were at a wedding or a party or even a school athletic practice. Let them know who else was in close proximity. This information helps us protect other people from COVID in our schools and throughout our communities. We've seen a number of COVID cases in schools so far. We're working to keep those numbers low by doing swift and robust contact tracing in partnership with schools and local health departments, but we need help to make that happen. Over the past couple of weeks, many individuals, including parents, teachers, administrators, elected officials, and the community in general, have requested a public-facing dashboard to accurately identify the number of COVID-19 cases in our schools. The State Department of Health has been actively working to achieve this, and we think we can accomplish this in compliance with all the privacy laws, as we talked about last week. But we have a remaining obstacle. To this end, we need access to the most up-to-date school rosters as they are submitted to the Indiana Department of Education. This will allow us to identify which schools we notify and which local health departments need to be engaged. Having access to the most up-to-date roster for each school is critical to our ability to inform a school of a positive COVID case in a student. Currently, we have about 10% of the new data that has been submitted to the Department of Education. We are still working collaboratively with the Department of Education to establish this data flow continuously to the Management Performance Hub and, therefore, to the Indiana State Department of Health allowing them access. We don't have that data as of yet. Without it, our ability to provide efficient and timely contact tracing and notification to schools is compromised. The Indiana Department of Health is committed to continuing to work with the Department of Education and doing everything we can do to protect our students, teachers, and staff in all of our schools. It's now my pleasure to welcome Dr. Dan.
Thank you, Dr. Box. Thank you, Governor Holcomb. Today we are releasing our long-term care dashboard. It will be accessible from the Indiana COVID-19 dashboard. On that page, there will be an option to review long-term care facility data. On the LTC dashboard, we will report both new and cumulative resident and staff cases and deaths. This data will be updated weekly. Facilities are still required to submit new cases within 24 hours of knowledge. To assure the highest confidence in the data we report, we are verifying information submitted to us in our systems. For instance, we would verify any reported case by confirming a positive lab in our system, and likewise, we would verify a reported death in our system. Since the verification process takes time, the data presented will lag by 1 week. As we have mentioned, the data file you have been accessing, that includes the historical information from March 1st to July 14th, represents preliminary data submitted by facilities. The data on the dashboard includes the verified historical data along with all new data that has been submitted and verified after July 14th. I should also mention that 100% of facilities have submitted their data, and this is also reflected in the new dashboard numbers. Because staff can work at multiple facilities and residents can be transferred between facilities, there will be cases that are counted by more than one facility. These cases, however, will only be counted once in the aggregate number. So, if a staff works at 3 facilities and tests positive, that case would be attributed to each facility, but would only be counted 1 time in the total aggregate number. To preserve privacy, we will not report specific number of cases by facility if the total is less than 5. At the top of the dashboard, you will see both new cases and aggregate cases. So, for the week ending August 5th, there were 215 new cases and 30 new resident deaths. This brings us to a total of 6,664 resident cases and 1,753 resident deaths verified since March 1st. Staff data for the week ending August 5th included 136 new staff cases and 0 new staff deaths. This brings total staff numbers to 2,945 cases and 11 deaths. The dashboard will also contain aggregate demographic data for cases and deaths similar to what is currently reported on the statewide dashboard. One thing you will notice on the new dashboard is our map. On the map, we have 3 toggles. One to show all of the long-term care facilities in our database, and this will allow the public to zoom in and identify facilities in their area. Clicking on any dot will change the tiles at the top of the dashboard to represent the new and cumulative totals for that specific facility. Hovering over any dot will also show these numbers but will not change the tiles. The other map toggles will show only those facilities who have to date reported a positive case or death. You can also search for a facility by typing in its name or zip code. In a manner similar to our statewide dashboard, you can also review cases and deaths by day, and this is displayed in the bar graph similar to what you're used to seeing on the state COVID data dashboard. We will update this dashboard weekly on Wednesdays. As with our state dashboard, we'll provide you any updates or changes that we implement. Thank you for your patience as we have built this out.
Thank you, Dr. Dan. Okay, Rachel, we're about at 3:30. Yep. Let's get to the Q&A before.
Tom Davies, The Associated Press.
Good afternoon, Tom.
Hello, Governor. With more schools reopening and many of them having outbreaks or cases of COVID in their among students and staff, are you changing or considering any additional action on benchmarks for how schools should handle that? That continues to be a question that districts are struggling with.
No, we'll continue to work with districts, and Dr. Bucks, you want to talk about, he's talking about metrics or benchmarks, and we're working with schools to make sure that they are keenly aware of what the community spread is in their area, but the relationship about that spread to the decisions that they make as a local community.
So again, we are working with metrics that we know will give us more insight into the community spread that we're having. And with our higher positivity rates that we're seeing around the state, we're not surprised that we are seeing cases in the school. We are working on a county by county, school by school basis and working with them to help limit the spread of these cases. And that really is the critical part of this, and the ability to have that knowledge immediately that there's a positive case in the school, which will probably, hopefully, come from parents, teachers, staff, and students themselves that know that they've received a positive result, so we can start working on that immediately. If we have to wait for the test to come through and then us to be able to contact trace that and identify this as an individual student from that school, there's going to be a delay in that. So I strongly encourage parents, while their students being tested, to have that student stay home until that test result is back, to quarantine the siblings of a child that you may have at home that's positive, and to make sure that you notify your school immediately if you do have a positive child in the school.
You want to also just underscore or repeat what you mentioned earlier about, and oftentimes I'm talking to employers and educators, superintendents around the state, and many of them are confident that the environment that they have put together is potentially maybe the safest place where an employee or where a student is all day long. But I think it's worth repeating what you mentioned about tracing, how important that is, in addition to the testing, but also where we're seeing some of these cases pop up at weddings and gatherings outside of school or outside of work, and then how that does then affect.
And I think that's the critical part. We've talked a lot about our increasing cases are really coming from those that are ages 0 to 19 and 19 to 29. Really, it's that 19 to 29 that's probably the highest group, but 14 to 18 is certainly contributing a significant component. As we trace this back, we find that it's usually a party, a birthday party, a graduation. It was a football team getting together with cheerleaders and the other kids from the high school to celebrate school opening back up. All of those things, weddings that are contributing, unfortunately, to these cases, they're really not necessarily getting this at school. So again, it's more about what happens socially a lot of times with this age group than what's happening in the school system.
Yeah, Tom, I would just say before we move on, this is about not letting your guard down. And oftentimes we're seeing at the place of employment or at schools, there's a lot of school spirit, a lot of creativity that's gone into this that we're seeing all over the place. Some real cheers that are going on about how to mask, how to physically distance, how to resituate a classroom safely. And so the guard is up when you're in those environments, but it's when then you go off into your separate corners of the world that sometimes the guard comes down and you feel the most comfortable, like, well, I know my whole family reunion, the whole family gathering, but this is where it can occur as well, especially then when you get into those bigger gatherings. And just because you know someone doesn't mean you know every single place that they've all been as well.
And I think that points what's really important, Governor, and that is that if I would encourage parents to do anything, it would be to help your kids to identify and define their pod of friends, kind of their bubble of friends that they're going to hang out with and they're going to be with socially, and that limits it rather than having their closest 100 friends at a party that they went to. Maybe it's the 6 or 8 of them that are routinely together. So there's still socialization, which is so important to their development and to their mental health, but not necessarily with 100 or 200 of their closest friends.
Right. Thank you.
Meredith with WLFI.
Good afternoon, Meredith.
Good afternoon. Can you hear me?
Crystal clear.
sorry, I'm using a different computer, so I wasn't sure. My question is concerning the Big Ten postponing its season. It will obviously have a huge impact on college towns like ours here in West Lafayette. Are there any plans to help those communities financially due to this, specifically like hotels and other establishments that, bring in millions of dollars from these large events?
Yeah, Chris, with O&B, the director of O&B, you want to just give a quick update on not just our CARES Act, but the relief fund that's going into schools for testing, et cetera, and communities, and those literally different pots of money that are helping not just college towns, but those communities at large.
Chris Johnston, excuse me, with the Office of Management and Budget. As the governor mentioned, part of the coronavirus relief fund has different programs that have been set aside to help local communities. But in addition to that, the Lieutenant Governor's office has started a program. $10 million have been allocated to communities to help support their community events and arts foundations that are so integral to those communities. So I think across the range of those programs, there'll be opportunities for small businesses through the IEDC, the community and arts programs through the Lieutenant Governor's program, and then also we have the $300 million with the Indiana Finance Authority for local governments to access those programs.
And then they've got some direct funding from our federal partners to the institutions of higher learning.
Yes,
as
so
well.
just as far as the education programs, in addition to K through 12 receiving funding, the schools themselves had received funding. The institutions of higher ed have received I think $300 million worth of funding. Half of it has to go to the students, but the other half can be used for the institutions.
Thanks, Chris.
Eric Berman, WIBC.
Good afternoon, Eric.
Afternoon, Governor. Looking at the curve as the positivity rate and case increase that Dr. Box mentioned, that seems to have started a couple of weeks after we went to stage 4, when, among other things, the bars opened. In hindsight, were the stages out of order? Were the large outdoor gatherings that are still banned under stage 5, should that in stage 4 have been flipped?
No, I feel comfortable where we are, county by county, and what stage we're in. Obviously, this is an ongoing effort to work with our local partners. We'd always like it to be lower. We think it's got more to do with, because we're seeing very responsible businesses, et cetera, open up and provide safe places to do commerce. We have to see that across the board, and we have to see, like Dr. Box has mentioned a couple times here, our personal actions outside of the workplace, outside of going out to dinner, outside of doing all the things that we'd like to get back to in our daily routine. And if you look at the mobility patterns, those are all up. And we see countless examples, as I mentioned, of oftentimes those places are the safest place. It's when we let our guard down in these, like, we're not going to, I mean, Eric, I think I would ask you to contemplate this. When we trace back where these, where the spread is originating, oftentimes it's at a wedding or a funeral or a big family gathering. Obviously, if there are one-off spots that are ignoring guidance and ignoring requirements, ignoring recommendations, then yes, that's a problem. And we'll continue to lean into this and try to educate from a state perspective. And also, local communities, our partners, are going to have to do some enforcement as well.
We have some specific examples of that, Governor, where our local health departments have actually gone in and shut down some bars and other facilities that were not following social distancing, masking, and other things that were required. So I agree with you. So, although some people are doing a really good job with it, others are not.
Yeah, and it has a real effect on, you know, we're laser focused on our health and the adverse impact this has on our lives. We're also focused on what that has, how that has an impact on our livelihoods and our economy. So when you're talking to employers who say, hey, I've got 14 people out or 140 out, or pick the number, because they're COVID-19 positive, or they've been quarantined because they've been around someone, that's not occurring at the business itself. It's occurring in these personal decisions that we're making. And so we want to stay on track and open. We want to continue to grow. Look, as I mentioned last week and probably the week before that, again, don't want to be a skipping record, but we're continuing to bring in job investment, career investment, business investment into this state. So the good news is we have the people, we have the job careers that are available, and we have the workforce training providers that can skill folks up, even during this time. But what we need is a safe environment, meaning wherever you go, you're bringing your safe routine into the equation.
Adam with WTIU.
Afternoon, Adam.
Hey, good afternoon, Governor. Can you hear me okay?
Yes, perfectly. Thank you.
All right. Just have two questions for you. Last month, you had called on health departments to oversee gatherings of more than 250 people, and some of those departments said that was the first they heard about that requirement. On top of managing the risk of overseeing large gatherings and trying to supplement the state's contact tracing efforts, do you think that the health departments are a little bit overburdened? And my second question is regarding President Trump's executive order pertaining to unemployment benefits that will require states to match $100 of that. Can Indiana afford to do that?
Cut right to the chase there. Dr. Box, you want to talk about the first? I mean, it shouldn't have caught anyone off guard. We've been sharing this information.
We have weekly webinars with them to discuss this and to go over this. We have gone through some of those plans with some of the local health departments. To say that they're not overburdened, I think everybody in public health is pretty overburdened and in general in government. So I'm not surprised. And we are doing the very best we can to lend hand with our regional epidemiologists and other people that work across the state in different regions and at our centrally located office here at ISDH.
Yeah, and we'll continue to work with and partner with all of our local health departments throughout the state of Indiana. We're learning a lot through this. No one ever anticipated something as, a lot of folks believed that COVID-19 would come and go and we'd be through it by now and it was a seasonal thing or maybe a few month endeavor, but no, this is going to be with us for a while. So we're learning how to manage our way through it, and we're going to have to do that with our local partnerships. Obviously, they're so key. And quite frankly, I'm excited about working with them well into the future about how we can even navigate our way through whatever would come next. So this is not all just about right now. This is about the future as well and having a little vision with it. Fred, you want to talk about, this is the first time I've seen you not on the phone with some of our federal partners. We have not made final decisions on the latest executive orders that came out of the president's office last weekend. But you want to share with Adam and everyone else kind of how we're working through all these potential changes and how all the pieces fit together, because this is a lot of new guidance and still some questions up in the air before we make final decisions.
Yes, Governor. There is a lot of new guidance out there right now that's being put together. So we are in a concerted effort with our federal partners, both the U.S. Department of Labor and FEMA, practically on a daily basis, trying to really understand what steps we need to take, what timing looks like, and really in terms of dollars, just what's actually out there and how does that all play out. So right now, Indiana, just like many other states, all the other states, we're not in a position to give any definitive answers on just how that will look and how it plays out. The one thing that we do know for sure is that this will require us to create a new system yet again. As you may recall, when we set up the federal systems for PUA, PUC, and PUC, we had to set up new systems. This will be, again, another system. So we are working not only with those federal partners, but we're also working with our sister agency here, Homeland Security, to make sure that we shore up any gaps before we go ahead and make any decisions.
Thank you, Fred. You live in the land of acronyms, don't you, with all the different programs? Yeah.
Brandon with Indiana Public Broadcasting.
Afternoon, Brandon.
Afternoon, Governor. I have a couple questions, both about the school's announcement, the school funding announcement. First, help me out with the technical details. How does moving the count date affect school funding? And would that affect school funding for the entire school year or only half of the school year? Help me with the technical issue, part there, and then I'll have a follow-up.
Okay. Yep. Katie, you want to talk about how if we move it to December, then that puts us into January and we can address the further conversation. But moving that ADM to December locks us in for the rest of this year.
Sure. I might not get into that level of specifics, but let me give you a high level to answer your question. First of all, the announcement, as an educator, the announcement today is exciting. I'm already hearing from some superintendents and education associations who are expressing their appreciation for the governor and Senate and House leadership. This allows some near-term certainty and commitment as we begin to start schools across our state. And actually, we've already been in contact with the State Board of Ed Executive Director, as well as the ERB Executive Director, and all of the different agencies that will play an important part in developing this administrative rule. Some of your questions, I think they are excellent, they are spot on, but I really believe it's important to allow our agencies the time they need to clearly articulate the next step forward, and I think they're going to move this pretty quickly. So again, thank you for your questions.
Yeah, and I would say that, when I first reviewed this, Brandon, the statute was a bit unclear. It was written at a time that didn't contemplate COVID. Thankfully, it did contemplate illness and gave the SBOE the ability to move that date, and we can get you the written law for you to review, but that's what it's doing. It's moving the date to December that allows us to get through this year.
And then my second question was, so this provides certainty, whatever it will look like, will provide certainty for sort of the first half of the school year, and then the legislature is back to deal with the second half of the school year. But given what we know a lot of members of the Senate GOP caucus feel about this, and given that ensuring 100% funding would require a change in state law, how can you provide, especially given your track record in the Senate GOP caucus on tough bills over the last 3 years, how can you provide schools any sort of assurance that they'll get what they need in the second half?
Well, I'll take my track record, Brandon, any day. Well, that's obviously, this is, as I said, not only was this statute a bit unclear to begin with, it was also focused on schools that were going 100% virtual. This is a little bit of a different animal, and so this should require legislative input statewide, not just leadership, but statewide. We should be discussing this, and just like any other topic. Obviously, what we wanted to do is lock in right now and say during this point, you do not need to be concerned about this. And how we then address virtual education, we'll have time to do that. Now, if we push it back to December, which is what we're recommending, which is what I want to see, then that gets us to the point where we can have that more full discussion on this whole topic. And we'll have the benefit of seeing where we are, 4+ months from right now with COVID-19, how it's affecting, seeing, as I mentioned 3 or 4 weeks ago, where students are, where they're learning, what school are they at, what option are they taking, are they benefiting from. Obviously, as I've said, ideally we want them in the classroom, but we want them in a safe classroom. If that's not possible at this moment, and virtual is the safest, then I want to make sure schools know, parents know, students know there's a safe alternative to learn. And that's what this 100%, locking this 100% in over the course of this year is all about.
Max Lewis, WSBT.
Good afternoon, Matt.
Good afternoon, Governor. How are you?
Very good. It's
good.
It's past 3:30 and we're still getting warmed up.
Perfect. My question, I have 2 questions actually. One's probably for Dr. Box. I just want to ask about, there's sort of a disparity up here as far as school reopenings with St. Joe, Elkhart County metro area. The Elkhart County Health Department recommended that kids can go back to school. The St. Joe County Health Department said, no, they can't. I guess I'm wanting to know, I've heard from lots of parents who are sort of confused about this, why Elkhart's reopening when the activity rate's higher and some of their other statistics are higher than St. Joe County. I guess what assurance, if anything, can you give to those concerned parents, or if you've had any conversations with the local health officers up here about that?
So I have had lots of conversations with Elkhart County, and we've been very actively engaged, boots on the ground, as has the CDC with Elkhart. And we did have a big discussion about schools and whether they would open or not and how they would open. I have not had any discussions with St. Joe County. I do know that the local health officer there and his deputy health officer, both very competent people, and I know that they're making the decisions that they feel are best for St. Joe County.
Okay. And Governor, I want to ask about, again, in St. Joe County, the health department is putting forward a bill that they would like to actually fine businesses who, have employees who are not wearing masks, who don't, aren't complying with regulations per se. I wanted to know if that's something you support. I know Marion County does that as well, but just what your thoughts are on that.
Yeah, from the very outset, Matt, we've sought to not just work with locals, but support locals. Obviously, we understand that, there are proactive decisions you make, and then there are reactive decisions you make. And oftentimes, if folks aren't being good teammates about this, and you start to see something spiraling out of control, then that's where this local enforcement becomes critically important, and trying to truly manage your way through it, getting control of it to the extent that we can. We know there are a few things that we can do that does help slow the spread: wearing masks, physically distanced or socially distanced, good hygiene, et cetera. And so I'm very sympathetic to local leaders making these decisions to try to get a handle on it. And I'm very empathetic, quite frankly, to folks who are losing their loved ones because others are disregarding good guidance and good recommendations. And so therefore, we'll continue to, our disposition will be to work with local leaders in terms of the ways that they best see fit to safely operate.
Sherry with the Indianapolis Star.
Good afternoon, Sherry.
Good afternoon. This is a question for Dr. Box. A couple of times last week, I believe it was, we saw case counts over 1,000. Today we saw a real dip. It's really been the lowest that's been midweek. So I have a two-part question. First of all, do you think have we seen a turn in the tide in the 671? Is that a technological glitch? And do you think we need to kind of accustom ourselves to seeing 1,000+ case counts, or will we be reaching a lower plateau?
Sherry, I don't know if you were eavesdropping on our conversation that we had about an hour ago, but we were talking about this exact topic and how we have to, as we're consuming all the data that comes in, understanding the timing of it, the truing up of it. Dr. Dan talked about this in our long-term facilities, but I think this is worth a few minutes of looking at those, back to back to back over 1,000 numbers, and then going down to 574 or whatever, that we received a day, and how that all truly is real time or not.
So I think that we oftentimes see a little bit of a dip in the number of tests that are done on Wednesdays, and so our number of positive cases oftentimes will follow that, obviously. Last week, when we had those over 1,000 days, our testing numbers were way up at that point in time, too. 12,000 tests done at that time. Personally, I'd rather be kind of where we were last week, because it means we're testing more people and we're getting out there, and that's what I want to see, is high testing numbers, and that's what will help us to know that we are testing enough of the community across the state of Indiana. But definitely we see dips. The higher numbers after the weekend because the tests get run and hit our dashboard, a little bit of a lull. We also will be seeing some changes because our teams will not be out doing as many of our drive-through testing sites because we are working with our long-term care facilities for the next 3 to 4 weeks doing the testing there.
You also want to talk just a little bit about the difference, so maybe this will feed into Sherry's question, the difference of reporting of negative and positive at times.
Mm-hmm. So a lot of people ask me, like, if they calculate a single day, this was the number of positives we had. A number of, positives that we had today and the number of tests that were done. And it will always look higher, like, 11, 12% even sometimes. And we don't look at that single individual day for a lot of reasons. Number one single number is not very demonstrative of a real trend or what's going on. But number two, it takes a little longer a lot of times for our negative results to come through than it does our positive. And that's why if you look at our dashboard and look at percent positivity, you'll see the last 5 days or so are kind of considered preliminary numbers, maybe even up to 7 days, because we don't know those numbers change a lot.
One more thing, if I could, just to pile on Sherry's question. You also want to talk about how we may be a little different, our reporting of negatives, positives, than other states, even states close to us, how we're more unique and in line, I think, with CDC's preference.
There's unfortunately no one single definition of how percent positivity should be calculated. In the state of Indiana, we do the positive individuals, unique individuals, meaning they've not been tested before, over the number of unique tests that we've done. So that if you look, for instance, at the dashboard today, we had 5,760 individual new tests, and those would have been unique people that were tested, but we had 8,084 new tests. So there's typically a 3,000 to 4,000 test difference there. A lot of states, our neighbors, will calculate their percent positivity on the total number of positive tests over the total number of tests done. And that will result in adding in a lot of negative tests that we're not adding in if people are getting repetitive negative tests. So that tends to bring the percent positivity down.
Thank you.
Rob Burgess, the Wabash Plain dealer.
Good afternoon, Rob.
Good afternoon, Governor. How are you today?
My microphone is unmuted. I'm
Wonderful.
doing great.
Good deal. So I had a question for you and also Dr. Box. Dr. Box, with schools reopening, do you have any updates on the multi-system inflammatory disease affecting children who get the virus you first discussed several weeks ago?
Yep.
And Governor, could you give an explanation as to why you're not extending the moratorium on evictions and utility shutoffs?
Sure.
I think that's an excellent question, Brandon. Or Rob, I'm sorry, I've been waiting for somebody to ask again. With children, if they become infected, a lot of the times they are asymptomatic. Most of the time they are either asymptomatic or very, very mildly affected. In fact, if you look at all positive children, only about 8 children who are positive per 100,000 positive children will get admitted to the hospital, versus adults, that number is 165 per 100,000. So that does give us some reassurance. But there is this very rare multi-system inflammatory disease of children that does occur. And that is a disease where children become seriously ill. They will be hospitalized with it. It's an inflammation, oftentimes of multiple organ systems. Could be the gastrointestinal, so the bowel. It could be the heart. It could be kidneys and other areas. The good news is, in the state of Indiana, although we've reviewed 28 cases, we have only confirmed 13 cases, with 1 pending that we're reviewing now. All 13 of those cases, those individuals have been discharged to home, which is great news. Our mean age is 11, and the ages have ranged from 2 to 18. 38% of those cases were female. We do have a breakdown, too, in that 4 of the cases were white, non-Hispanic, 3 were black, non-Latino, 4 were white, Latino, and 1 was a Pacific Islander, and 1 racial and gender identity was not known. So that is our latest update.
And in terms of your second question regarding the eviction moratorium, no, Rob, we did, as announced last week, We do have options that are in place. We have invested $40 million. We're obviously going to be watching what that balance of that account, how it's affected in our rental assistance program. We're also working to make sure that there are mediation programs in place to help folks. In terms of the utilities moratorium, in light of today's IURC ruling, now utilities are required to offer extended payment arrangements for a minimum of 6 months, and to all customers for actually an additional 60 days. They're also suspending some fees, including late fees and deposits and disconnection and reconnection fees, et cetera. I can make sure, Rachel, why don't you make sure that we get the IURC's press release out to Rob and anyone else who wants it. We first and foremost, Rob, we want to make sure that we're addressing the need that is out there. We believe that there are mechanisms on both fronts.
Elizabeth, WNIT Public Television.
Yep. Good afternoon, Elizabeth.
Good afternoon, Governor. Election administrators across the state say that they're struggling to find polling places and poll workers for the November election. What is your advice to them as they seek to avoid an election day nightmare in which crowds of masked and unmasked voters wait in line for hours to cast their ballots? What strategy should they pursue?
Well, we're all in this together. I mean, it's not just a slogan. We're all going to have to work together. I suspect there'll be a large turnout. There are multiple means to vote. Obviously, I want to underscore this fact that if you are 65, if you are ill, if you are confined to your home, if you're knowingly going to be out of your county or your area on election day, then you should be requesting an absentee ballot. But we also want to make sure that, in addition, there are safe places. The Secretary of State, Connie Lawson, during the primary made sure that polling places had the required resources to accommodate that turnout on the final day of in-person voting and the days leading up to it. So I would and I am encouraging people over a 28-day period. This is not just an election day concern. This is a whole month in advance, just like if you were to go to the grocery or to get other essential items. Make sure that you're spreading it out, which will help us slow the curve just in general. But there has to be safe ways to vote if you can't in person, and there has to be obviously safe places to vote in person, and there are on multiple days leading up to that election day.
Stephanie Wade, WRTV.
Good afternoon, Stephanie.
Hello, can you hear me?
Yes.
Okay.
Clearly.
Good. Dr. Box, you mentioned today that ISDH is working to create the dashboard tracking COVID-19 cases in schools. We've been trying to keep track ourselves, and by our count, there are 55 confirmed cases just at Central Indiana schools right now. My question is it fair with this number of cases that superintendents are left to navigate this pandemic on their own and make these tough decisions regarding student health and safety? I've personally heard from some superintendents say to me that they wish they had more help and specific, clear guidance because it's tough making these decisions right now. And I know every school district may be different too, but you've said that this virus knows no boundaries and we're still fighting the same virus.
I understand. All of the decisions that we've made with regards to this pandemic have been difficult decisions to make. And that's why our local public health people and the State Department of Health are happy to partner with any superintendents, principals, school administrators, local health departments across the state to help in that decision-making process as we look at all the different metrics of their particular county.
Justin with the Westville Indicator.
Good afternoon, Justin. Thanks for joining us and staying with us.
Good afternoon, Governor. A local county official recently told us that the state would no longer be providing free COVID-19 testing at the end of this month and would be shifting this responsibility to the counties. Is this the case, and what was the state's motivation for doing so? Also, has the state shifted some contact tracing responsibilities back to the county as well?
Not only is that news to me, that's
News to me
not the
also.
case. Yeah, not the case. You want to speak to it, and maybe, Chris, I may call you back up from a funding perspective and just to underscore funding that's available for locals to do testing.
So there are no plans with regards to that at all to shift that to the county. I will say that eventually it would be great for insurance to cover COVID testing just like it does for any other disease process out there. But no matter what is happening with regards to that, we will always be able to COVID-19 test individuals that don't have health insurance, that are homeless, that may be undocumented individuals that are here. It is critical for us to be able to control the spread of this disease, to know who's infected and who is not. With regards, the other was a local health department question.
Yeah, but you want to also talk about just the Optum sites that are all around the state.
Oh,
that
sure.
Some do move around. You talked about
Sure.
the mobile, but
So I think I gave the numbers today, but almost 200,000 tests from Optum sites. We have 39 active Optum sites right now, of which 6 of those are actually double sites because they're so busy and we're doing so much testing. And also we're adding another 3 double sites to the state. So we are continuing to beef up testing around the state that is CARES Act dollars supported. And then the Indiana State Department of Health, as I mentioned, has done 26,000 tests alone in this past month with our strike team. So with certainly no backing off on testing.
just the opposite. And you just want to touch very quickly on some of the funding that's available. If that was where this miscommunication occurred, was some folks might have thought, well, we can go the local route or we can go the state route. Lots of locals are doing testing too.
Well, Dr. Box sort of told the whole story here, and between her agency and fiscal folks, as well as OMB, we're coordinating the resources, both with money that's dedicated directly to the Department of Health, but then also what I had spoke to before, the Coronavirus Relief Fund, as far as supporting both those efforts, both statewide as well as the coordination that Dr. Box spoke to of providing the additional resources for local health departments.
Thank you, Chris.
Whitney Downard, CNHI.
Good afternoon, Whitney.
Good afternoon. I'm sure Dr. Dan is already moving up to the podium. Dr. Dan, I've got a couple questions specifically on staffing. What kind of staffing support did the state offer to long-term care facilities, some of which already had staffing shortages before the pandemic?
Sure. Early on in the pandemic, we did 3 separate things to try to help support long-term care facilities around having more staff and keeping their staffing levels appropriate. One was across the board rate increase for all facilities. And then for those facilities that would be taking in new COVID patients, they might have a dedicated area of their facilities, what we would call making their facility COVID ready. We had a smaller bump in the percentage. And then lastly, we had funds available for facilities who were actually taking care of COVID-19 patients. And with all of that funding we've done, along with, I think, the CARES dollars funding that have come from the federal government, we have specifically guided them to use those funds to help with testing, PPE, a large portion of which we've been providing, but also to help keep staffing levels appropriate, and whether that involved increasing the pay for staff who would be working in these facilities. So along the way, we've been providing additional supports to them for this.
Thank you, Whitney. And Dr. Dan.
Leanne with the Daily Journal.
Afternoon, Leanne.
Good afternoon. I have a question about the election. With many Hoosiers asking for mail-in ballots, do you think it's time to eliminate the need to state a reason why when requesting a ballot?
Yeah, I think that question should be answered, would be more appropriately answered with General Assembly input in January when we come back. When you go from Obviously, when we were under a stay-at-home order statewide, that was one Exhibit A, if you will. Exhibit B is we are very mobile right now in the state of Indiana. And so to make that kind of drastic change on the fly while we are mobile, I think would be inappropriate. Now, that is a discussion worth having for all kinds of various reasons. Set aside COVID-19, but for all kinds of other reasons, that is a discussion I think is worth having, and I'd look forward to having it in January when, again, we have statewide input on that significant of a change.
Kayla Sullivan, Fox 59.
Good afternoon, Kayla.
Good afternoon, Governor. So recent ISDH stats show 81% of the state's ventilators are available with COVID-19 patients. They're utilizing only 3% of the ventilators available. Does this surprise you that so few COVID patients are on ventilators compared to early on in the pandemic? And why is this?
Want to answer that one, Gov?
Yeah, I mean, no, I think that this is a question that I hear a lot about, actually, from folks all over the state. And because there was so much talk, so much need at the very outset when there was urgent needs. And we've learned, myself included, but physicians have learned so much over the last few months, different treatments that are available and more appropriate, how to, where you don't have to use a ventilator, so to speak. So there will still be a demand for ventilators for a number of reasons globally, but you want to talk to Kayla's question about, you know, this is one of our 4 guiding principles, that we have the resources needed to treat people that are in need of treatment and care. Ventilators was a part of that we do still talk a lot about, beds and ventilators, but I think she's hitting on something a lot of people think about.
You had a really good answer for it. Actually, the reality is that we learned how to better care for these individuals. We learned, you know, early on that kind of the knee-jerk automatic reaction was to intubate these patients. That's how we thought we would best be able to take care of them. That was the advice that we had gotten from other countries that had been a little bit ahead of this curve than we were. We were actually kind of warned against using steroids, and now we know that dexamethasone is probably one of the most important things we do. We didn't really have the option to use remdesivir. It was very, very limited, and we now have that on a more regular basis. And we have had lots of opportunity to network as physicians across the state. I know Dr. Weaver has led a lot of those webinars, and IU Health has been engaged, and she's had specialists come in to talk about this. So we have learned tremendous amounts of things. I will say that the ventilator usage and the ICU bed usage is up, and that's because I hear from my fellow friendly doctors who are in the emergency room all the time that people who are coming in now are pretty sick. Some of them have put off getting their heart checked or getting other health conditions taken care of, and so consequently they think that the severity of patients that they're seeing in the hospital has been elevated also.
You want to just mention what you taught me weeks ago about even beds that can flip. You can flip patients and
So
alleviate.
just putting a patient prone has made a large difference, and using a different type, it's not an intubated type ventilation, it's what we call a BiPAP machine, has really made a difference. And again, that's been a learned process in very early studies, and a huge, huge shout out to our team of researchers through FSSA, Regan Streif, and IU Health and IU School of Medicine. Really, they've come together and pulled regular data for us to review and look at and help to guide our physicians across the state.
And a huge shout out to Ventec and General Motors GM up in Howard County for what they were able to do, turn on a dime and start to meet the demand, not just here in Indiana. Obviously, we had things under control and managed at that time, but across the country and the world. And so, again, this just points out, Kayla, that some investments that we made and lines that we changed on the fly. This is not just with ventilators, but with masks, with sanitizer, et cetera. That's going to serve us well into the future. So some of these challenges have brought about some real progress.
Our final question is from Kathy with the Ferdinand News.
Kathy, welcome. You're batting cleanup.
Hello. Good to see you both.
You as well.
I actually have 2 questions.
We had a letter to the editor last week, and this might be feeling like beating a dead horse, but this person was opposed to masks and said, open sourced information also shows that wearing a mask for less than 60 seconds causes one to rebreathe enough of their own CO2 to make themselves sick, not to mention the lack of oxygen their body and mind requires to operate properly. I would like to have you clarify that. We publish our letters to the editors as they come, and I would like you to address that because a lot of readers read that.
I understand that and have heard that from more than one person. I can tell you that there have actually been studies that show that it does not increase your oxygen level and it does not increase your CO2 level because you wear a mask. In fact, as a surgeon and surgeons all over the state wear masks for many, many hours, sometimes 12, 14 hours at a time. We oftentimes in the emergency room have to do that mask on a regular basis. And we wouldn't be able to function if our oxygen levels were dropping and our CO2 levels were going too high. So there's no truth to that.
I thank you for that because I feel like maybe we were disseminating incorrect information even through a letter. My other question is, I've heard even from business people who I've greatly respected, this is all going to be over November 4th. What do you say to those people? I'm serious. I have heard that multiple times.
Well, I'm not your bookie, but don't bet on it. If we've learned anything, it's, we wake up every day with 3 scenarios in mind. One, that it's going to stay the same. One, it's going to get worse, or one, it's going to get better. And we're trying to do everything we can 24/7 to realize the third scenario. And that will require us all to do our part. So there should be no, well, I'll just punt my responsibilities because this will all be over on any given day that you hope will occur. That is not a strategy for good health or success.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.